It's good to be back with all of you. And in this week's presentation, I'd like to continue our focus on vaccines. In our last presentation, we heard from Dr. Ronit Mashuri, our Chief Public Health Officer, and Dr. Jesse Goodman, an infectious disease specialist and faculty member at our medical center. Both serve on our Public Health Advisory Group. They described the significant protection that the COVID-19 vaccine provides to individuals and how it effectively reduces the spread of COVID-19 in communities. We also discussed how public health guidelines are evolving as the number of vaccinated people in the United States grows. At Georgetown, these evolving local and national guidelines have provided the context for us to adjust our mask policy and our testing policy for those in our community who have been vaccinated. We have also taken steps to expand vaccination coverage in our community. We announced this past April that all students will need to be fully vaccinated for COVID-19 before returning to our campuses for the fall semester. We have partnered with the DC Department of Health to ensure every member of our community has access to a vaccine, and we now offer free vaccine appointments on campus. We also partnered with the city earlier this year to host 3 vaccination clinics for residents of Washington, D.C., with the help of Georgetown students, faculty, and staff volunteers. And we have just announced that we will be extending our vaccine mandate for all faculty and staff who will be on our campuses. With this decision, all members of our community are required to receive one of the approved COVID-19 vaccines before returning to campus, a step that will both protect our community and contribute to the local and global fight against COVID. We will provide medical and religious exemptions as required by law, and we have prepared detailed information on our website for members of our community who have questions about how this requirement will be implemented. We're also taking steps to make sure it is as easy as possible for our community to get vaccinated. Staff members can use COVID-19 paid leave to receive their shots and if they are experiencing any side effects. Once a staff member provides proof of vaccination, they will receive 2 additional days of paid time off, which they can use at any time this coming year. We gave this decision the most careful consideration. We engaged across our university, our faculty senate, our staff AAP advisory council, our academic and administrative leadership, our public health advisory group, and our board of directors. In these conversations, we heard how strongly our community is committed to our layered public health approach and the important role that vaccines play in contributing to greater safety for the entire community. Vaccination is important for a few reasons. First, COVID statistics across the United States have improved in recent weeks due in large part to the significant rise in the number of people who are vaccinated. Over half of the U.S. adults are fully vaccinated. For the month of June, the United States has been seeing fewer than 15,000 new cases per day. We are seeing the fewest deaths since March 2020. We know vaccines are effective, especially for those most vulnerable to the virus. When we look at older adults, one of the groups with the highest risk of complications from COVID, studies by the CDC indicate that once the vaccine was introduced to older adults in the United States, we saw decreases in cases, emergency room visits, hospital admissions, and deaths. Older adults who were fully vaccinated were 94% less likely to be hospitalized than those not vaccinated. We need to make sure that the vaccines continue to reach our most vulnerable populations and the communities that have been disproportionately impacted by COVID over the past 16 months. Second, while there are many public health measures that can help fight COVID-19, widespread vaccination is the best protection against transmission. In fact, there are some strong indications that the rate of COVID-19 among those who have not been vaccinated is of significant concern. Looking at data from Washington State, the Washington Post has found that when adjusting for vaccination status, the rate of COVID infections today for people who are unvaccinated is as high as it was in late January. Vaccines are especially important to protect people in congregate settings. As Dr. Mashori described in our last presentation, congregate settings where people regularly gather in close proximity to one another confer a greater overall risk for COVID-19. Colleges and universities, particularly those that are residential, have the characteristics of a congregate setting. We are seeing many of our peer institutions also requiring their students, faculty, and staff be vaccinated. As of a few weeks ago, 80% of K through 12 teachers had received at least one dose of a vaccine. The American Medical Association has found that 96% of practicing physicians are currently vaccinated. The more COVID-19 continues to spread, the more likely it is that new and more dangerous variants will emerge. We are seeing the devastating effects of these new variants. Just recently, the CDC has changed the designation of the Delta variant, which first emerged in India and is becoming more prevalent in the UK. It has moved from a variant of interest to a variant of concern. The Delta variant is more transmissible and can cause more severe disease. Widespread vaccination will be essential to prevent the Delta variant from taking hold here in the United States. So far, studies have demonstrated that vaccines are very effective against the variants, including the Delta variant. This is one of the reasons why global access to vaccines is vital, and why it is important for those of us who do have access to vaccines to protect ourselves and protect our communities. This is a global effort. Nationally, there is some concerning evidence that the rate of vaccination is slowing, and we may have to contend with low vaccine uptake rates in some areas. We are hopeful that the vaccination rate in our region will continue to grow. We are reaching a level of 50% of residents who are fully vaccinated here in Washington, D.C. Our experience on our campuses is linked to vaccination and transmission levels in our region. What happens in our region comes here to our campus. What happens on our campus goes back out to our region. For this reason, we must ensure that as many people as possible are vaccinated at Georgetown. By doing so, we help keep our community safe, and we do our part to contribute to overall protection of our broader communities. Throughout this entire pandemic, we have taken seriously our responsibility to bring our 26,000 members of our community through this crisis. We know that vaccines are safe and effective. We know that they protect us from severe disease, hospitalization, and death. We know that vaccines reduce community transmission and overall risk to the community. We know that getting vaccinated helps protect the most vulnerable around us, those who do not yet have access to a vaccine, those who may be unable to be vaccinated, those who are immunocompromised, and young children for whom the vaccine is still being reviewed. Receiving a vaccine is an important step that each one of us can take to contribute to the safety of our community and the communities around us. I hope that this presentation has given you a sense of our approach and of the factors that have helped to shape our decision. And I look forward to being with you again soon. Take care of yourselves and take care of everyone around you. For every Hoya, everywhere.